My name is Dr. Tasha, and we are going to address a common question. Are all breast lumps cancer? So, let's get started. To start off with, let's clarify what a breast lump actually is. A breast lump is a localized swelling or growth in the breast tissue. It is usually felt when you do a breast examination. Breast lumps can vary in terms of how they feel, and their characteristics can provide clues about whether they might be benign or potentially cancerous. So here are some general descriptions of how breast lumps might feel. Benign lumps. Many benign lumps can feel smooth and well defined. They might have a round or oval shape, and they often feel mobile within the breast tissue. This means that they can be pushed around or moved with a little bit of gentle pressure. How about potentially cancerous lumps? What do they feel like? These, on the other hand, can feel firm or hard, and some cancerous lumps might feel just a little bit different to the surrounding tissue. Cancerous lumps may also have an irregular shape and can feel uneven or irregular. Lumps that are fixed in place and don't move easily when touched could also be slightly worrying. Now, there are other characteristics to consider as well. Monitoring the lump over a menstrual cycle or over a few weeks might reveal changes in the size or tenderness. Benign lumps can sometimes change with hormonal fluctuations, while cancerous lumps might not change as much, if at all. It's important to remember that the texture and characteristics of a lump can vary widely, and there's no definitive way to determine whether a lump is benign or cancerous based solely on how it feels, unless, of course, you are an expert. Any new lump or change in your breast tissue should be evaluated by a healthcare provider. Now, the thought of finding a lump can be worrying, but it's essential to remember that not all breast lumps are cancerous. The big question is, how do you know whether a breast lump is cancerous or not? It's important to emphasize that a definitive diagnosis requires a thorough medical evaluation. Healthcare professionals typically conduct clinical examinations and may recommend imaging tests like mammograms or ultrasound scans. If the lump appears worrying or needs further investigation, then a biopsy is often performed. This involves taking a small tissue sample from the lump, which is then examined under a microscope by a pathologist. This analysis provides crucial information about whether cancer cells are present or whether they're not. Now, if a breast lump isn't cancer, then what else could it be? There are actually several other potential causes of breast lumps that are not cancer. And here are a list of some of the common ones. Fibrocystic changes. Hormonal fluctuations throughout the menstrual cycle can lead to development of changes called fibrocystic changes, which can cause the breast to feel lumpy. Fibroadenomas. These are benign lumps that is the commonest cause of lumps in young women. They are made up of glandular and connective tissue and often feel smooth and rubbery. Cysts. These are fluid-filled sacs that can form in the breast tissue, causing lumps. Cysts might change in size over the menstrual cycle, and they can also be slightly tender. Fat necrosis. Injuries to the breast, such as from trauma, if you knock the breast for example, or after surgery, can lead to fat necrosis, which is fat death. This can cause the formation of a lump that might feel firm, even similar to the feel of a cancerous lump. Infections. Infections like mastitis, which is breast tissue inflammation, or abscesses, which is a localized pus collection, can result in breast lumps, accompanied usually by redness, warmth, as well as pain. Lipoma. A lipoma is a non-cancerous fatty lump that can occur in the breast tissue, and it feels soft to touch normally. A hamartoma. This is a benign growth that contains a mix of normal breast tissues like fat, glandular tissue, as well as connective tissue. A galactocele. In women who are breastfeeding, milk-filled cysts known as galactoceles can develop in the breast, causing lumps. And hematomas. These are blood clots or pools of blood from an injury that can cause localized swelling and lump formation. So it's crucial to remember that not all breast lumps are cancerous. And while finding a lump can be worrying, the majority of lumps are actually benign. Early detection and proper medical evaluation are key to understanding the nature of the lump and ensuring appropriate treatment if necessary. I'll see you in the next one.